In our continuous show reel of federal ministers who gave account of their stewardship in the outgoing year 2021, this week we present to you the Federal Minister of Health, Dr. Osage Ehanire, who spoke on strategic initiatives and efforts of the ministry to improve the Nigerian health sector.
First is to say that we are targeting universal health coverage. One of the problems we have had in this country is a poorly structured health system, which we are looking at setting up right now under this administration. Primary healthcare center available per political ward. You have to make healthcare accessible, affordable, and acceptable to the people, and the quality must be good enough to give them the confidence to accept your health care. Now, I have spoken of the primary health care per political ward, where we intend to upgrade the primary health care center, make sure it has solar powered light or any other source of lighting, and also we have water supply and a staff quarter. Once you have that, you have a platform for reaching a whole community, and if you have a large ward or a heavily populated ward, you can have 2 of those centers. This will bring healthcare coverage by this administration's projection to 80% of Nigerian citizens, and reduce all those horrendous figures that you hear coming from Nigeria on maternal mortality, which is about 54,000, child mortality, which is about 800,000. The second is to increase the quality by training more health personnel, more nurses, doctors, and health technicians in all areas, and providing the equipment and the organizational structure that makes it possible for people to trust care service. Right now, only 5 or 6% of Nigerians have access to healthcare through an insurance cover. We want to, by 2030, if all things go well, because we have a bill that still needs to be signed into an act, be able to offer health insurance to 70 to 80% of the population, so that there will be no need for out-of-pocket payment. By that, you make the healthcare available to a large population, and by that, you're able to attend to many of the ailments that presently leave the population helpless. Also provide a pool of funds that will cover the provision of that service. If you put all the hospitals together, it's nearly 60 and growing. If you add all the agencies onto it, it's going to 90 something. And most of them have governing boards who are supposed to look after the affairs of those hospitals or agencies they are supposed to be governing. But nevertheless, quite a few things slip between the cracks, which the ministry has to then address. And I do hope that the initiatives we are working on, which we have tried to put together, will soon be brought into the forefront to carry out reforms in these areas to have a more efficient system. We have a tertiary standards committee which we have just set up, and this committee has Nigerian experts from abroad, Nigerians who study and work abroad, who will be members and be able to bring their own experience from outside to join the Tertiary Health Standards Committee in looking at how the hospitals are run and what improvements they need to make. This is one area where we need a reform to increase confidence in it and efficiency and improve service delivery for the citizens. We have a National Strategic Health Plan which provides the guidelines, 5 pillars and 15 priorities that sets where we want to go. We have National Health Policy, but this is one area where it is not only the federal government that is involved. The state government plays an important role here, because the state governments are the ones who will give licenses for hospitals to operate in their states and also participate in supervising what goes on in the hospitals. Then, of course, you have the Medical Dental Commission and also the Association, that's the Midwives Council, who regulate the quality and practice of the individuals who go into provide service at our institutions. Again, here we need to set standards because many of these institutions were set up many years ago when we didn't have so many hospitals, when we didn't have so many doctors, so many nurses. But now that the population of doctors is increasing, more and more medical schools are coming up, the number of hospitals is increasing, and also the private hospitals, which also need to be regulated, they are all coming up. We're going to be working on reforms to improve or perhaps decentralize, because the more they are, the more difficult it is to cope with individual institutions. Private sector in Nigeria actually offers up to 60% of the services, more than the public. Although also there's a bigger question of affordability there. A large number of people who are not able to afford the private sector, and many of them are very high-level work, high-level surgery, high-level services that, in fact, in one or two cases, some of our teaching hospitals are trying to meet up with. If you look at the newest initiative that's coming up now, is the National Emergency Medical Service and Ambulance System, NEMSAS, which intends to provide health services to Nigerians in emergency situations. Now, this is a classical PPP where the assets of government are going to work with the assets of the private sector. In ambulances, for example, they have more ambulances in the private sector than the public sector, who are going to come together to be available to give emergency service to whoever is in need and dials a number 112 and is directed to a call center which should locate the caller, locate the nearest ambulance, and send the ambulance with trained paramedics, provide service, and take that particular patient where necessary to an urgent care center or to a teaching hospital to give them treatment and then refer them to a definitive treatment spot. And for every one of these services, the person who's receiving the service will not be charged at point of care. It will be paid for by this system. That will save a lot of lives because the argument about who is paying for you will be removed. And the fund is being created to assure the beneficiaries, and the health providers, they are assured that they will be paid, which is the special point about this program. We have the National Health Management Information System, which we set up, which works here in our area, and the district health information system, which collates information at all sites, and then the M&E personnel who feed information into the system and serves the public health area and also the policy area to help decide where what is needed. Also in inventory control, what kind of materials and equipment that we require. So it's a very important part of our health system. And in the area of HIV, for example, we use such information to know prevalence, how many cases are in each area, and what kind of treatment each area requires. The same for tuberculosis. Are we carrying out the notification? Where have I seen a case of tuberculosis and put them under treatment? All these are the ones that require long-term treatment. So data is extremely important, and also the collection and management of data is critical here, and we're continuing to build on it. The health insurance also working very hard to create that for management of its cases, of its clients that are registered in the insurance service scheme. Is it community health based on the primary healthcare center? That is to say, the infrastructure, the human resources, the equipment, and then the commodities and wherewithal to run primary healthcare system efficiently. Secondly, a mechanism for delivering healthcare in emergency, because not being able to attend to patients in emergency is responsible for the large number of loss of lives. Women who are delivering, for example, have obstructed labor, or children who have a pneumonia, or those who have had an accident. So developing a medical emergency service is the next. Then the next layer is the general hospital, where referrals go to from the primary healthcare or from private centers. And finally, a reformed tertiary hospital system that functions efficiently, respectfully, and treats their patients with dignity and productive, that we have such confidence that nobody wants to go abroad for treatment again. All this will be enabled by the primary healthcare system, the secondary health system reforms, the tertiary health system reforms, the creation of a national medical emergency ambulance system, and then all driven by the NHIS, National Health Insurance System, State Health Insurance System, Community Contributory Health Insurance, which is already going on in some states, like Kano. And of course, all of it supported with a very sound public health system and all overseen by the Federal Ministry of Health.